616. Thank you.
Proceed.
Thank you. Hello, my name is Dr. Sujata Kesi. I'm one of the doctor in this department today. May I know your name, please?
Yes, doctor. My name is Elizabeth Perkins, and I'm 30 years old.
Okay, is it okay if I call you Eliza?
Yeah, you can call me Elizabeth.
Okay, Eliza. So,
Elizabeth.
okay, Elizabeth. So, how can I help you today?
Well, doctor, I have my baby. He's 6 month old, doctor. Sorry, 6 weeks old, doctor, and he's been quite vomiting for like 2 days, doctor.
Okay, Eliza, I'm Elizabeth. I'm sorry to hear about your son, but before we proceed, can you confirm his name for me, please?
Yes, he is Reese, and he is 6 weeks old, doctor.
Okay, thank you, Elizabeth. So, can you tell me more about his conditions?
Yeah, doctor, I'm here because I'm quite worried about him. He has
Okay.
been vomiting for the past 2 days, doctor.
Okay, Elizabeth, I'm really sorry to hear about your son condition. So, can you tell me what is the color of the vomitus?
Well, doctor, he's been vomiting.
Okay.
Whatever I gave him, I usually give him milk, doctor. Actually,
Okay.
he's 6 weeks old, so I have not given anything besides the mother's milk. So I have
Okay.
been breastfeeding him. But whenever like I have breastfeeding him, he's been vomiting the milk, doctor. I see the milk.
Okay, Elizabeth. So, can you tell me how much he is vomiting, like amount, like cup of?
Yeah, I like he's been drinking the milk from me,
Yeah.
and he's been drinking I can say like a large amount of milk. Whatever he's milk taking the milk, he's throwing the milk. Like I can say like say a bowl of milk.
Okay, Elizabeth. So, have you noticed is the vomitus goes far away
Yes,
or?
Yes, doctor. Yes, doctor. The main thing I have noticed about Reese that he's been vomiting the things far away from like a fountain. Like
Okay, Elizabeth. So, have you noticed any rash in his body?
no, there was no rest, doctor.
Okay. Is it the first time he is having such type of vomiting?
No, doctor. He's like talking about it is the first time for
Yeah.
2 days, but he's been
Okay.
vomiting like 3 or 5 times for these 2 days.
Okay. Is anything that makes his vomiting better? Like, have you tried anything?
Like if we did not feed him anything,
Okay.
the vomiting won't be there. But if we feed him, there will be vomiting.
Okay. So, have you give any medications to him?
No, no, no. This is the first time I'm here to see Reese.
Okay, Elizabeth. So, is he running a temperature?
No, no, doctor. No temperature was there.
Okay. By any chance, he sustained an injury?
No, doctor. I don't think that I have that he has sustained any injuries.
Okay. Any diarrhea?
No diarrhea is there, doctor.
Is he pull his leg up to his tummy?
No, no, doctor.
Okay. Is he pulling his ear?
No, he is not pulling his ear.
Okay. So, how's his appetite? He is feeding well?
As I told the doctor that he is not feeding well. He is
Okay.
just vomiting everything.
Okay.
So since he was born,
Okay.
his feeding is not good, doctor.
Okay. Have you noticed any abdominal swelling?
Yeah, doctor. Whenever I fed him, I just
Okay.
noticed there's some swelling over his tummy.
Okay, Elizabeth. So you told me that he is not feeding. So
Mhm.
can you tell me how many times did you change his nappies?
Yesterday I have changed him one nappy, and today I haven't changed any nappies, doctor.
Okay, Elizabeth. So I would like to ask few more questions regarding your pregnancy and raise development. Like, how was your pregnancy?
The pregnancy was good, doctor. There was no like any problem with the pregnancy.
Okay. So is Ray's need any special care after the delivery?
After delivery, no, doctor. He was fine. Normal
Okay.
delivery.
Is he up to date with his vaccinations?
Doctor, he's 6 weeks, doctor. So I
Sorry.
think there is no need for vaccination right now.
Sorry. Any allergic to any medications?
No, doctor. I haven't noticed any allergies, doctor.
Okay. Apart from this vomiting, he's having any other conditions?
No, doctor.
Okay. Anyone in your family having similar conditions?
No, doctor. We don't
Okay.
remember anything like that.
Is he your first child?
Yeah, he's my first child, doctor.
Okay. Now, thank you for answering my questions, Elizabeth. Now, I would like to examine your baby.
Mhm.
I will observe his vitals that
Mhm.
will include the blood pressure, heart
Okay.
rate, oxygen, temperature, and his weight as well.
Mhm.
And I will also examine his tummy, and I will do a specific test that we call a feeding test.
Okay, so what does feeding test mean,
Okay,
doctor?
I'm here to tell about this. When is in this test, we ask you to feed your baby, and at the same time, we will examine his tummy to see if there is any mass or not. Is that okay with you, Elizabeth?
Yes, doctor.
Okay, Elizabeth. So, from what we have discussed so far, and after examinations, I'm suspecting the Andrew has a conditions called pyloric stenosis. Have you heard these conditions, Elizabeth?
No, doctor.
Okay, Elizabeth. So I'm here to tell you about these conditions. It is usually the narrowing of the pylorus. Pylorus is the part of the stomach opening in which there is a narrowing of the opening of the stomach into the small intestine. That is the small bowel.
Okay.
So when Andrew's having feeding milk, it doesn't goes into his bowel due to this narrowing of the opening of the stomach. So for the and also, Elizabeth, it is a emergency conditions.
So it's a serious condition.
Elizabeth, it's a serious condition, but at the same time, we have also a treatment for this condition. So it is a treatable condition. So now, what we are going to do for the raise is that we will admit him in the hospital, and we will do some investigations like routine blood test, liver function test, kidney function test, blood sugar. We will also do ultrasound to see is anything concerning the apart of this, is there anything or not, to rule out the other conditions. And if the conditions if the diagnosis is confirmed, at the same time we will also invite the child specialist. He will assist him, and if this conditions is confirmed, then we will do a uh, for this condition there is especially we perform a surgery what we call a pyloromyotomy. Have you heard this?
No, what is pyloromyotomy?